afternoon. My name is Dr. Cosentino. I'm on the Physician Advisory Board for the American Academy of Procedural Medicine, and we're going to talk a little bit about aesthetic training, specifically some of the different training programs, some of the different workshops that you can learn to get into aesthetics with the state of the economy and some of the things that are going on right now in healthcare. Physicians and other medical professionals really want to learn some cash procedures that they can add into their practice to generate a little bit more income, to perhaps improve their lifestyle just a little bit. And aesthetics is something that I could tell you on a personal level. I've been doing myself in my own practice. We have a medical spa, it's VIP Aesthetics, and it's actually really an enjoyable service to offer to your patients. You know, the services that we offer in our medical spa typically are things from Botox to dermal fillers to sclerotherapy, mesotherapy, lots of different injectable treatments. We do things like lasers and so forth. So aesthetics in general is actually a very good service to add to your practice to increase some revenue and to increase some cash procedures. I'd like to tell you a little bit more about the American Academy of Procedural Medicine and some of the different training opportunities that we have available. The American Academy of Procedural Medicine, the AAOPM, has been around for about 7 years. And what they do specifically is they offer training programs for physicians and nurses in topics such as aesthetics, pain management, anti-aging and weight loss and things like that. And they also offer a board certification pathway in aesthetics as well as some of the other areas that we talked about. So what's involved in integrating aesthetics into your practice? You know, specifically, what type of aesthetic training? Well, let me tell you a little bit about what we've seen most physicians and most other practitioners, you know, the pathway that they've chosen. Most of the doctors and other medical people that come to our program, they start off with injectable training, and I think that's actually a good idea because learning Botox and fillers is something, obviously it's in very, very high demand by patients, and it's really not that difficult to learn. Typically a Botox training program you can learn in a day, and the same thing with dermal fillers, and then over time obviously you're going to get more and more practice, and then you may take a refresher course and things like that. But most of the doctors doing aesthetic training, they start with the injectable training, the Botox and the fillers. Once they master that, you know, they may take an advanced program in Botox. They'll learn something like facial aesthetics, and it's actually a pretty good pathway to follow because a lot of people may not even realize that they're starting off with learning how to do Botox, which obviously treats the lines and the rhytids and all that, but sometimes people overlook the surface of the face. Okay, patients are not overlooking that though. They're coming to you with the complaint of, you know, how can you remove this hyperpigmentation, or they have an area of rosacea or an area of you know, redness and discoloration. So there's a program that the AAOPM offers. It's called Facial Aesthetics, and it's a pretty advanced program. It's very complete, and it'll teach the doctor everything from how to evaluate the skin type, how to evaluate the person's skin and the anatomy and so forth, to, you know, getting down to understanding the actual treatments and what's going to best serve the patient. All these programs are hands-on, whether it's a Botox program or fillers or a facial aesthetics program. There's a lot of other programs that the AAOPM offers in aesthetics, such as mesotherapy and sclerotherapy. But getting back to more specifically the pathway that physicians and other medical practitioners follow is typically they start with the injectables, which is going to be the Botox and the fillers, and then they digress a little bit towards mesotherapy, which is another injectable, and it's actually a very, very good procedure to learn because the demand is very high. You know, so we're learning how to do things like injecting patients to treat fat, you know, fat that's underneath the chin, fat and cellulite, as well as fat in the legs and areas like that. And it's a very effective treatment, and it's simple to learn. But in addition, it's probably the cheapest procedure, or the most inexpensive procedure to implement into your practice, because unlike Botox and fillers, you know, where you have to pay for the medicine and so forth, the cost of mesotherapy or the mesotherapy supplies is very, very low. You know, it may cost, you know, $25 for a bottle of something, you know, like a phosphatidylcholine deoxycholate solution that could last you, you know, 5 or 6 patients. So the cost of adding mesotherapy to your practice is actually very, very low. and the financial gains are very rewarding. We'll talk about that a little bit more specifically, the financial returns on some of the aesthetic procedures, on a different video. So we'll continue with our aesthetic video series. But for now, I'd just like to kind of address a little bit more about aesthetic training and the pathway that most of the physicians take. So again, to summarize, they start with injectable training, such as in the Botox and the fillers. They'll go to mesotherapy, and they'll start doing some of that procedure and start learning a little bit of that. And then they'll start to do facial aesthetics. Okay, and the nice thing about those 4 procedures is you're really covering a pretty broad range of treatment options that you can take care of your patient with. Sometimes we see a doctor or nurse that'll come and all they're interested in, let's say, is Botox. The problem is that if you start to get good at Botox and you have a patient coming in, you start to work on their face and so forth, and then they ask you, they say, well, what about this wrinkle? They don't maybe necessarily know that that's a fold, and they don't know that fillers can treat that. You don't want to be in a position where you're saying, well, I don't really treat that. I only do Botox. And then they end up going somewhere else, and then that doctor does the fillers, and then that doctor also ends up doing the Botox as well. So you want to make sure that your training is complete and that you have enough to offer to your patients. And at least starting with Botox, fillers, mesotherapy, and facial aesthetics, you're covering pretty much the whole face. You can treat the lines and the wrinkles. You can treat the topical area of the face if there's any hyperpigmentation or if there's any discoloration or problems with skin tone and texture. You can take care of that. And of course, if there's any fat, mesotherapy treats fat everywhere, but at least you can start off with the chin. So I think as far as aesthetic training, that would probably be the 4 best areas to begin your training. Just a couple more words about the American Academy of Procedural Medicine. In addition to the different training options that they have, they also have board certification pathways. And a little bit about the board certification pathways. There really are not many board certification programs that you could attend to get board certified in aesthetics. This is one of the few. The American Academy of Procedural Medicine has a physician advisory board. I'm one of the doctors. There's actually 6 other doctors. And, they have training programs all over the country, probably about once a week, in all these different areas that we started talking about, not just aesthetics, but in pain management and medicine and anti-aging and so forth. There's also a board certification pathway that where a physician or a nurse can become board certified. And just kind of in summary, what's involved is taking the training or getting trained, in aesthetics. And it's not just, it wouldn't just be programs offered by the American Academy of Procedural Medicine. If you have taken courses elsewhere or you have experience, you would submit that information. You'd submit some sort of documentation that you've had this training, and then the physician advisory board would review that. But getting back to the summary of requirements, it's basically training. Okay. Then there's exams that you take at the end of every program, and these are practical exams. So they're actually online exams. There's 4 online exams that you have to take. After that, it's basically a 6-month fellowship scenario in aesthetic training. So during that 6 month, you're also submitting 2 case studies. All right, case studies in Botox or treatments that have had, or patients that have had, some sort of aesthetic treatment. And then there's, after you've done the classes and after you've done the training and the case studies, now you're eligible to sit for the written board exam and then the oral board exam. And when you complete that, there's a little bit of a process, then you'll become board certified in aesthetics. But anyway, that's really all I have for a little information about aesthetic training as relates to the American Academy of Procedural Medicine. If you have any questions, obviously, definitely feel free to call. You can speak to myself or one of the other physicians, or if you want to just maybe some general questions for the staff. There is a website. It's www.AAOPM.com. The phone number is 954-358-2854. So if you have questions and you would like to speak to somebody in person, by all means. And that's about it. Thank you.